All right, Carly, thank you. The virus known as mpox is being described as a global emergency. But is it cause for concern for Kansas City families?
Dr. Ben Grin from the Kansas City Health Department at Kansas City University is with us this morning with some insight. Dr. Grin, good to see you. Welcome.
Good morning.
Thank you so much for having me.
Tell us how serious mpox is, how it can be.
So, mpox is a disease that is caused by a virus in the smallpox family. You may remember there being an outbreak of mpox in late 2022 in the United States. That was a global outbreak. That outbreak was primarily affecting the community of men who have sex with men. This new outbreak is really centered in Central Africa, in the Democratic Republic of Congo and neighboring countries. It's a serious outbreak. There have been about 15,000 people affected and more than 500 deaths.
Oh,
Wow, that is serious. What are some of the symptoms of mpox?
So the most common symptoms of mpox include a blistering, painful rash, also fevers, other flu-like symptoms, swollen lymph nodes. In some people with weakened immune systems or other risk factors, they may also develop more severe symptoms like blood infection, lung infection, and people can even die from this illness.
Wow.
I remember it being kind of a long recovery process, a couple of weeks. Is that still the case with this new strain?
It can be. We're still learning a lot about this new strain, and it may be acting differently than the prior strain. But the strain that we saw in the U.S. in 2022, where there still are some cases, the skin lesions can take a long time for folks to recover from. And really, you're still considered contagious until all of those skin lesions blister over and new skin develops over the lesions. So I think that was the really hard thing for some folks, is that they had to isolate for, up to a month even.
Yeah.
Oh, my goodness.
Yeah.
What are it's kind of a tough question for you, doctor, but I mean, what are the chances of it coming to the United States and becoming a problem here?
I think it's really hard to say. I think at this point, the outbreak has been centered in Africa. There's been a case in Sweden of someone that was returning from travel to Central Africa, but I don't know at this point what the likelihood is that it comes here. I think the public health authorities are working hard to prepare in case it does.
Yeah. And like Nick mentioned, if someone were to travel to that area and may not know about it and travel back, and they have maybe some symptoms, what should they do?
I think they should go see their doctor, or see their doctor or their healthcare provider, and try to isolate from other folks until they get more feedback from their physician.
Is there a vaccine for it?
There is a vaccine for it. At this time in the U.S., the vaccine is only approved for men who have sex with men with specific other risk factors, like having recently had a sexually transmitted infection. So a lot of folks in the U.S. won't be eligible for that vaccine right now. It's really important that we get that vaccine to Africa right now so that we can prevent the outbreak from spreading. But for now, I think in terms of vaccines, the most important thing for the public to know is to get vaccinated for illnesses like COVID-19 and the flu, which are spreading at this time. And there is a new vaccine against the newer variants of COVID-19 that was just recently released.
Yeah. And if our viewers aren't sure, what is mpox? Well, it used to be called monkeypox, right? Why did they change the name?
Yeah, it's a great question. So the reason it was originally called monkeypox is because the virus was first isolated in a lab monkey in the mid-1900s. It's really not thought that it's being transmitted from monkeys to humans. And in addition, I think the term monkeypox was just felt to be stigmatizing. So that's the reason they changed it to mpox.
Makes sense.
Yeah. Dr. Grin, very informative. Thank you. Important topic.
Yeah.
Thank you
Great
so
stuff.
much.
Come back and see us. We appreciate it.